Hi, I'm Dr. Jonathan Zelken and welcome back to my vlog. Today I'm talking about an interesting topic that includes all of us, including myself, the plastic surgeon. And there is this all-encompassing, kind of annoying, kind of pervasive phenomenon called the selfie phenomenon. And it's basically this idea that everybody no longer really wants to capture the experience of what's happening around them, but more they want to capture themselves within an experience, and they like to share it with the world. And there was a recent survey by the American Academy of Facial Plastic and Reconstructive Surgery that said 55% of surgeons will recall at least one patient in the past year explaining that they want to make their social media pictures, I guess if you want to call them that, better as the rationale for why they want to move forward with facial surgery. So what is driving this entire sort of mammoth force, this entire paradigm shift in my practice and the practice of plenty of other plastic surgeons and med spas throughout the country and the world? It is, yes, our cell phone, the black mirror, and the selfie. What is it about a selfie that is driving current trends in facial plastic surgery? It's a really good question. And when I sit here and I'm talking to a camera that is about 10 feet away from me through a microphone with standardized lighting in a standardized space, I kind of get a pretty fair impression of what I look like to the outside world. That is in distinct contrast to this camera, especially the selfie camera that points towards me. It's a way lower resolution camera, way lower quality image, but more importantly, it's not very common that people are looking from this vantage point, maybe arm's length distance from above right or above stage left down towards you. Yeah, I would look at my patients that way perhaps, but it is an unconventional viewpoint. And it is that exact viewpoint that is driving a lot of self-perception. So many people will almost self-value their current look, the way they look, the way they feel based on an image that is taken from a cell phone camera. So if I were to put my little selfie mode on and go in a standardized, duck face selfie mode, the image that I'm getting from this view is kind of how I'm determining what I look like in real time and space. It makes me feel like I have a really big nose. Fine, okay, I have a big nose, I get it, don't make fun of me. But it does definitely emphasize that feature. It also makes my jawline, which is kind of big in real life, look a lot smaller than it actually is. Perhaps this is what explains that recent boost, that trend in my own practice of reduction rhinoplasty, and also with my nurse and esthetician, the jawline fillers. Jawline fillers are incredibly important, and temple fillers are also gaining all this popularity because if you look at yourself in this one limited view, it's going to distort things such that your ears and your temples and your hair look a lot smaller, but your central face, your eyes and your nose are a lot bigger. This is a fisheye view that is unique to the selfie vantage point from a modern camera, a modern iPhone camera or Android camera, for example. So it's really important to keep these things in mind when you're determining what it is about you that you wish to improve. And it'll also help you become maybe a little bit more realistic in your expectations for what you want to enhance and why you want to enhance them. I think a very thoughtful conversation with your plastic surgeon or your aesthetic nurse will come in handy prior to agreeing to move forward with a procedure. You don't want to spend thousands of dollars and walk away with an outcome that you weren't planning on. You don't want to look objectively better, but maybe in a selfie video, you look the same. You want to make sure that your plastic surgeon, your aesthetic nurse knows exactly what it is you want to fix, and that person, if a good doctor or a good nurse, will guide you accordingly and say, I don't think it's reasonable to achieve this Snapchat filter result with a combination of Botox and fillers and things like that. Or, if you have a bump on your nose, can I make a single, side profile of you look better by putting filler above and below the bump? Yeah, I can make your nose look like a perfect ski slope in doing that, but I'm also adding up to 2 cc's of filler into your face. That's gonna make your nose objectively bigger. So you want a sort of, a holistic view. Why are you doing what you're doing? Get an artistic sort of understanding of what it is you want to enhance. understand this whole selfie phenomenon, read up about it. It's fascinating. The psychology behind the selfie is just a tremendous science that can be its own sort of college subject or even a major. It is definitely rampant in the world around us, and it's something that we should all, as providers and also as patients, understand thoroughly prior to moving forward with aesthetic surgical and non-surgical procedures. I hope this video sheds some insight onto this interesting and pervasive phenomenon, and I hope it helps you understand what it is that you want better. Have a great week, and I can't wait to see you next week.